mobilization for forward bending. So just as Nick talked about, with the backward bending technique, that, you are getting a relative forward bending. If we are going to now change our contacts to the transverse process, then we can actually provide a, more posterior to anterior force, which is directly related to that forward bending because of the mechanics associated with forward bending. So that, bilateral anterior glide that's created. So the patient's in the same position. Now your hand contact is going to change. There's two techniques. So I'm going to show you the two-hand technique first. So you're using your index and middle finger to palpate and find your transverse processes. And so when you're delivering your force and kind of palpating, your arm is going to be pretty much trying to contour to the spine. So your hand's not up here, it's not off to the side, and it's just trying to, relax as you're kind of moving along the spine. And basically, it's really challenging to, when you first start, learning this technique, to find the transverse processes, but it's really just a slight bump that you'll feel as you move through the spine. So the biggest thing is first getting a sense of, are you on a transverse process or not? And so once you find the segment that you're treating, you're going to use that same ulnar border of your hand directly on top of that index and middle finger that are palpating the transverse processes. Same direction of force, going anteriorly. You're directly over your patient. And so the motion isn't coming from the shoulder, it's coming from that weight shift of the trunk. And then you can just progressively move through the spine. And the other contact would be a dummy thumb contact, which is used usually just for, like, if you're trying to target one side of the transverse process. And so another part of this that plays into the mechanics is if I'm only applying an impulse to the left transverse process, so I'm pushing that left transverse process forward, the right one's coming back, so we can essentially work on rotation in that same technique. So the thumb is going to be your palpating finger looking for that transverse process. Same ulnar border right on top of the hand. Delivering that anterior force. But if you choose really not to use your thumbs, that's definitely something that would be beneficial, not necessarily using it to, do these mobilizations. You can still use that two-hand contact by dropping one finger on the transverse process of the inferior segment and the other on the superior segment's transverse process on the opposite side. So essentially, with a straight PA, when we're contacting with two fingers, so let's say this is T3, both fingers on transverse process of T3. If I change my contact and drop my index finger to T4, I can still create that same rotation of the lower segment. So similar as if we were just pressing on one side.